Thank you very much, Gregorio. Can see my slide, okay?
We can, indeed.
Thank you very much. Good day to everyone, and thank you very much, Gregorio, again for involving me in this very important activity. I would like to start my very short presentation by acknowledging and thanking my co-contributor, Dr. Paula Fujiwara. She was the scientific director of the International Union for Tuberculosis and Lung Disease, among many other important global initiative and institutions she participated during her career. And with Dr. Fujiwara, as already explained, we conducted the literature review, the interviews and focus group discussions, and developed the first draft that we share with the ad hoc group, and then we continue working on including all the comments, suggestions, as Monal explained, up to the moment of publication. So thank you very much, Paula, and I know you are here today in this talk. Most importantly, also I would like to thank WUHA, all the colleagues here that contributed, and as well the scientific committee inside WUHA that also provided important suggestions and recommendations that were included in the final guidelines. But really, most important, I would like to take this time now to acknowledge face-to-face to all the people that contributed, the experts that contributed to these guidelines from the focus group discussions, the 23 people that contributed from around the world here in blue, and also all the people, over 100 people exactly, that answered the online survey, again, from around the world. Thank you very much, and thank you for participating in this effort, this tremendous effort. So before I get to the contents of the guidelines, it's very important to remind everyone that these guidelines are scientifically based, and they complement the current standards for safe international trade, which are outlined in the terrestrial code of WUHA, which is tenacious. It's very important to understand that they complement the current standards. These guidelines consider not only the science, but also the social, economic, cultural, religious factors that play an important role in what can be done in certain contexts. And although they focus on livestock species, they also cover wildlife and humans using the One Health approach. And before we get to some of the more details, it is important to acknowledge that these guidelines recognize that there is not perfect approach that fits all the countries or scenario. However, they offer a practical description of what are the tools available and advise at least on the minimum elements that countries should consider when attempting to controlling the disease. So my role today, with that brief reminder of what's important in this guideline, my role today, I'm being asked to briefly explain the contents, the technical contents of these guidelines, which already you can appreciate are the result of multiple steps, multiple sources, different opinions, and the understanding that, as I say, one size does not fit all. And of course, there are very diverse opinions and data and information, depending where it's coming from and depending the scenarios. So the way I will do this is, in this slide, you will see that the guidelines, of course, have text, have certain boxes. And the way I will go to explain this, of course, I cannot explain every detail, but hopefully we can talk more on the discussion at the end. I will start with this part here. Where to start? And this question is very simple to answer in two places. You need to understand, or country need to understand, what's the current status of bovine tuberculosis in the country. And for this one, you need scientific evidence of the levels of disease in animals and also the potential zoonotic TB risk. And also you need to understand what's the need for the business case to start implementing these strategies. And then, of course, and after you understand the level of disease, the magnitude of the challenge, then you need to assess what are the resources, the regulatory framework, and government policy to try to implement this strategy. That's key. So that is described in text, but as you can see, there are certain boxes here in which boxes in the guidelines summarize is kind of an executive summary of what has been described in boxes and the scientific evidence provides. So as an example, I will start with box number 1. What can be done to assess the current level of bovine TB or MTBC species in the country? Well, you can start with a risk assessment, estimation of the prevalence or hotspot, for which slaughter surveillance will be important, assess the risk of zoonotic transmission, and also the capabilities that countries have for tracing animals. Modeling exercises, disease modeling exercises could be very useful, but also more importantly, as I mentioned, an economic analysis, a cost-based analysis or return on investment also will be extremely important. When we think about resources and infrastructure, there are basically 5 sections that we highlighted on the guidelines. The regulatory frameworks on the control programs, and the government is very important that the government enable, facilitate, support these strategies. Of course, the technical capacity, for example, the diagnostic tools and the technical training needed to identify the infection of the disease. And of course, we cannot forget about the importance of funding. And we need to understand that in many cases in low middle income countries, funding is scarce. And we need not to forget the key importance of stakeholders and partner engagement. All right, and we will get to this a little bit more. And for this, awareness and communication are key. And all these are described in a little bit more detail. So for example, just a few points when it comes to technical strategies and skills, which are key to understand, estimate, and address the challenge for the disease. We need the laboratory network and infrastructure and the ability of quality diagnostics to be able to identify and differentiate MTBC species, especially when it comes to the potential risk of zoonotic disease in humans. Be able to differentiate and identify M. bovis or other animal adapted bacteria that jump into humans. When it comes to training, for example, knowledge, attitude, and practices surveys before and after implementation of certain strategies are highly recommended to assess whether or not these strategies are working, being accepted, etc. When it comes to testing, the use of algorithm and combination of available diagnostic tests is also very important. Of course, understanding that there is no perfect test, but these combinations help to either improve sensitivity of specificity of testing when appropriate. And also implementation of accreditation and certification for veterinarians and meat inspectors have been highlighted as one among many important factors to consider. When it comes to stakeholders, as Monar already mentioned, the way that I would like to summarize is like this. It is great. I mean, actually, it's necessary to have the support of high-level institutions such as WHA or WHO when it comes to zoonotic TB and the roadmap, the tripartite, and now the quadripartite. But it's even more important to have the involvement, engagement, and buy-in of local stakeholders. This is key. It is the local stakeholders that are going to run a given strategy. And when it comes to local stakeholders, of course, the veterinarians are important, academics and scientists are important, but the industry, in addition to the government, are key. And from my personal point of view, the key and most important of all the stakeholders are the farmers, the ranchers, the people that are taking care of the animals. Without them, this is a very difficult task. So the farmers need to be engaged and participating in this. And of course, they need to see the incentive, the benefit to be part of this. And this go together with the component of awareness and communication we have included in these guidelines that clearly indicate that also the general public and the media need to be involved. And these awareness and communications campaigns need to be tailored specifically to different stakeholders. And as I mentioned, the part of incentives and direct benefits to the farmer needs to be clearly communicated, especially when it comes to farmers. And for this is the reason that we include in these guidelines behavioral science expertise is needed to communicate and to hopefully impact in a positive way behavior and engagement from those most impacted communities or sectors of society directly, such as the farmers, or in the case of people at risk of zoonotic TB, those people are higher risk groups. Then if we move to more technical aspects, for example, testing, already some of the questions on the chat allude to this. It's very important that staff need to be trained in the main two ways to finding the disease, the skin test and IGRA. And the training and understanding and evaluation of DIVA tests and other DIVA antigens and other antigens, new antigens that could help in this task are also recommended here. But also, it's important to acknowledge and keep evaluating the use of standard tests, such as culture, for example, or new tests that are becoming available, and use these, as I mentioned before, in a combined manner to increase the sensitivity and specificity, respectively. One very key component is slaughter surveillance, and this is regular post-mortem slaughter surveillance. There is a lot of details here and a lot of science behind this, but in brief, it's very important to train people to identify granulomas, tuberculosis-like lesions, but not only just to identify them and stop there. The slaughter post-mortem surveillance, regular post-mortem surveillance provide a tremendous tool, for example, to identify potential hotspots. If this is combined with the complete confirmation of the lesions of the laboratory and the tracing back a lesion animal that has been confirmed to be infected by a MTBC species back to the herd of origin to start an entire process of trace in and trace out. This entire very complex process is key, and it could be a very important one in activity in low middle income countries. Now, when it comes to reduce a transmission between animals, there is plenty of information here, so I will just summarize it very quickly. Pasteurization and boiling of milk and colostrum is very important within farms to prevent transmission between animals. Animal movement control, we have described this one at some length, and is key both for internal and international trades. And then we have three more sections here that I will go one by one in a little bit more detail. So let's move to cleaning and disinfection. We here provide one example, and there are some pink boxes on the guidelines in which we provide examples, and this is just an example of the Canadian government on how to disinfect infected premises, farms. And of course, this is only one example, and it needs to be adapted to the local realities of each country. But in brief, you need to, once the farms are infected, it's important to understand you need to clean and disinfect equipment with chemicals that are effective against mycobacteria, and also take care of removing soil from housing. When it comes to tests and segregation, I'm not going to say much because the previous colleague from Ethiopia already talked about that, and we have provide two examples here, one from early 1900s and a more recent one, but is in brief is highly dependent. And one of the challenges with test and segregation is basically all the changes that the farmers need to do to basically have two separate herds. That's really what it is. It's two separate herds, one with negative or non-reactor animals and the other herd with the reactor animals. And of course, in simple words and in summary, once the animals are tested and classified as reactors and moved to the reactor positive herd, those animals should never be allowed to commingle or interact with the animals in the negative herd. And also, and of course, we describe many approaches that can be done in general that include separating the animals and biosecurity measures to also deal with the personnel, equipment, and the milk management to keep indeed the two herds in real terms separated. Okay. When it comes to vaccination, already a lot has been said about vaccination, and there is an extensive section, and one of the largest boxes, box number 12, is on vaccines. So what did we do for vaccines in these guidelines? As you can see, there is a column about what countries should consider, technical issues that countries should consider before using vaccination. And here, for example, vaccine coverage, or specific areas of the country to vaccinate, vaccine efficacy, and DIVA, etc. Some of the drawbacks and what future research is needed. But before I get to those, what is known scientifically about the vaccine? Despite the known benefits of vaccine, is prohibited. Why? Because it will interfere with the current skin test, and it will cause false positive. That's the reason why, the main reason why vaccine is prohibited today. The data evaluated in a systematic review in the year 2021, this paper was published. They evaluated 24 studies and 49 different strata, indicate that vaccine efficacy is highly variable. And when talking about direct efficacy, the results show that is very modest, about 25% efficacy. However, although it is well recognized that BCG does not completely prevent or eliminate the risk of infection in cattle, the common consensus among researchers is that significantly reduce the likelihood of infection, diminish or decrease the severity of clinical signs and lesions, and therefore subsequently help to lower transmission. So when we think about vaccine in these guidelines, the way the consensus reached in these guidelines is that one of the potential, it was said here, drawbacks, I call it as a challenge, and we need to be very careful with this, is the potential for unrealistic expectations by different stakeholders on the impact that vaccine could have. And also another very important consideration that came out of the large debate on vaccines by different persons that WUHA convened for this was the ethical considerations in countries where there is a shortage of BCG vaccine for humans. Okay, so those are very two important things that I want to highlight here, but every single thing in this box and in the text are very important. So when it comes to further research, it was very clear that, and this is the recommendation in the guidelines, that further research on BCG vaccine trials under natural conditions are needed. So when we come to this, for the need of BCG vaccination for livestock, we are encouraging that countries implement pilot projects under natural conditions. That's key. And important factors that already scientists have recommended to include on this are listed here in this list from 1 to 8. Some of them is the strain to use, the duration of vaccination, dose, how to measure disease, and one very important one is the M-bovis challenge in the country. What's the exposure that animals are having under natural conditions? As an epidemiologist, when I think personally as vaccine efficacy, I think it's very important to, when these studies will be conducted, to understand key study characteristics, the strengths and limitations of each study, especially when talking about external validity or trying to extrapolate results to other populations. For example, and that's general for any scientific study of any type, but when it comes for vaccines, specifically for tuberculosis, some of these are, for example, what's being measured, direct or indirect vaccine efficacy. That needs to be very clear. How was measured? With skin test, IGRA, lesions, culture, modeling, or scenario simulation, etc. When was measured? And this for me is key as an epidemiologist. When the temporal component was measured months after vaccination or years after vaccination because of the chronic nature of bovine tuberculosis. Who was studied? Of course, as an epidemiologist and a number person, this is key. The type of animals and the sample size. And where, for me, this is the most important, where the studies will be conducted or are being conducted, because as already been acknowledged and is very well acknowledged on the guidelines, the key difference on disease dynamic, prevalence, epidemiology, clinical severity, animal management practices that either keep the animals for a certain number of years or cull the animals for management, economic conditions, and that's not allowed to disease to progress. So all these are very, very important factors to consider when moving forward with this study. Now, the great news has already been evident in this webinar today. The great news is that efforts on this front are happening, and they are not only in Africa. For example, it's very important to make aware that when we talk about not high-income countries, in Mexico, there is currently an undergoing study, is a long-term, large-scale, 5-year study, and at halfway point of this study in June of 2024, yes, this year, over 3,000 animals have been vaccinated. And of course, it's not my job here to talk about these studies, just to acknowledge, and we have acknowledged this study on the guidelines. And despite the fact that I was asked to talk only about what was on the guidelines, I think it's very important to recognize the efforts that already colleagues, and I'm sure Dr. Kapoor, one of the senior authors of this study, will mention, the efforts that colleagues did on the study that was published on 29th of March, 2024, with this study in Ethiopia, in which both direct and indirect vaccine efficacy was measured. So I want to acknowledge that. Very briefly, to start finishing, when it comes to BCG, when it comes to wildlife, livestock interaction, there is, again, plenty of scientific information on the guidelines, but in summary, this is highly dependent on the wildlife species and the scenario of the disease in each country. But in brief, the strategies or the suggestions are 3. Limit interaction between wildlife and livestock, the use of BCG vaccination in wildlife species, which already is happening in some countries, and again, depending on the country, target wildlife culling in high-risk areas, following the standards of the terrestrial code of BUHA for this approach. Finally, when it comes to zoonotic TB transmission, it's very clear that more data is needed at a global level, especially when it comes to routine surveillance or identification of zoonotic mycobacteria in humans, and this is key. Public health, human TB sector need to start making efforts to identify M. bovis and other zoonotic mycobacteria among humans. And also, there is a key recommendation about the safeguarding of the food supplies, mostly milk, but also in some countries, meat products that could contain lesions and therefore be a source of infection for humans. When we talk about zoonotic TB risk, we are clearly emphasizing that this needs to be targeted among high-risk people or high-risk communities. And what are these? Well, people living in areas, regions where social cultural practices increase the exposure to zoonotic mycobacteria, where the consumption of unpasteurized milks or untreated animal products is extremely common. In rural communities where bovine TB is endemic and people have a direct contact with animals as well as indirect, and of course, the occupational aspect of zoonotic tuberculosis for workers or people that work closely with animals. And in this regard, with zoonotic tuberculosis, we have specifically indicated that it's necessary to the buy-in of these regulations by the affected communities, and the concerns of the community need to be treated with transparency, honesty, and accurate scientific-based information. So to finish up, and you will see that this section, although in the guidelines section for operational research is quite brief. This is the entire section. It's not a summary. What we are suggesting is that, as Monal already explained, this is a living document. Therefore, research needs to continue on the basic science of these strategies, on how we learn after these strategies or while these strategies are implemented, monitoring and evaluation. And here we are suggesting a few specific things about the acceptability of the proposed procedures, how I went to discontinue these practices based on the evaluations, how to implement the findings, and the optimal communication methods. So in conclusion, as already alluded by all the colleagues, there is no one-size-that-fits-all approach to address the challenges of TB in different countries. And this is because the disease is highly variable and context-dependent and greatly vary even within certain countries. So another important factor is to understand, well, we all know here that TB, bovine TB, is a chronic disease, and the experience of over 100 years clearly show that this is a long-term process that takes years and even decades to accomplish success. Therefore, a package of interventions is what we are proposing in these guidelines, and keeping in mind the long-term aspect. And these guidelines reflect current knowledge as today, 2024, and should be considered a living document. And of course, in the future, they will require review and potential adjustment based on new evidence or new results that will certainly arise with everything exciting that's going on in this front. So with that, here are the references that you can see. They are cited on the guidelines. I would like to thank you for your attention, and I will be happy to hopefully answer some of the questions that I didn't have time to cover here. Thank you very much.